Good morning everyone. I am Dr. Lakshmi Naathan. I am a consultant orthopedic surgeon in Kauvery Hospital. I specialize in trauma, joint replacement surgeries and regenerative medicine. Today I am going to talk to you about a new field, regenerative medicine, where we use stem cells in the treatment of various disorders. Many people would be asking what a stem cell is. Stem cell is a undifferentiated cell which is present in the body. It is present in abundance in children and also in infants, and as we grow, these cells diminish and they become less in number. In the past, we were not able to separate these stem cells from the body, so this treatment was not being used. But now, with recent technology, we have the capacity to separate these cells from the body and use it for treatment of various disorders. So what are these stem cells? These are undifferentiated cells, which means they have the capacity to convert into any part of the body. For example, if in a tendon injury where there is less healing potential, when we inject these stem cells, the healing capacity of the wound increases and the wound heals better. Also, in baldness, it stimulates hair growth. It's been used in the treatment of diabetes, osteoarthritis, and also in other tendon-related injuries. Orthobiologics is a field where we use these stem cells in the treatment of disorders in which related to orthopedics. For example, osteoarthritis and tendinopathies. What is osteoarthritis? It is nothing but the wearing out of the cartilage of the bone, especially in the knee and in the hip, which occurs in old age. Osteoarthritis of the knee is very common and is a very debilitating disorder of old age, where the knee gets completely worn out, which prevents the person from walking and also doing their routine activities. When this happens, the cartilage surrounding the knee joint gets completely worn out and it causes deformities of the knee and difficulty in walking. So what happens in osteoarthritis is the cartilage, which is a protective barrier for the knee, completely gets worn out, exposing the bone. When the bones start rubbing on each other, they cause pain and also they cause restriction of movements. With the advent of stem cells, we can treat this condition and we can in some cases reverse the effect of osteoarthritis. Stem cells has been advocated in early stages of osteoarthritis where some cartilage is still retained. Stem cells are present in the bone marrow, in the blood as well as in fat. We can separate these stem cells using a centrifuging mechanism where in bone marrow we have more stem cells which is less in fat and in peripheral blood. When we take it from the bone marrow, we centrifuge it, separate the stem cells and we inject it into sites where it is required, and this causes accelerated healing and also accelerated cartilage formation. But in advanced arthritis, when there is no cartilage left, the only option is total knee replacement. The other areas where stem cell is being used is tendinitis. Tendinitis is a disorder where the tendons get inflamed because of overuse, like in sports people and also in obese people or people with thyroid disorders and diabetes. The common areas where we have tendinopathies is in the elbow, in the ankle and also in the shoulders, where movement causes a lot of pain. So these disorders are related to inflammation of the tendons. This can be addressed by the injection of stem cells. For this, we take stem cells from the blood. We take around 20 ml of the patient's blood, we centrifuge it, separate the stem cells from the blood and we inject it into these areas where stem cells are needed. This causes accelerated healing, reduced inflammation and also pain relief. This is another advances in the use of stem cells in the treatment of tendinopathies. The common conditions where we use is tennis elbow, which is also called as lateral epicondylitis, and also plantar fasciitis or heel pain. Heel pain is another very debilitating problem in young ladies and also in patients with thyroid disorders and diabetic disorders, where the tendon gets inflamed and it causes chronic pain in the heel and also in the knee and sometimes in the shoulders also and elbow. When we inject these cells, these stem cells along with some growth factors accelerate the healing capacity of the tendons, reduce the inflammation and promote healing and also relieves pain. The other disorders where stem cells has been used is avascular necrosis of the femur, which is another name for death of the femoral bone. This is another disorder which happens in young athletes and also in people due to unknown causes, and also people using steroids and also smoking and alcoholism. For them, the head of the femur, that is the hip bone, this is the hip bone, this undergoes necrosis and becomes dead. In these cases, the bone does not have the capacity to regenerate, and total knee replacement or total hip replacement is the only resolution or result for these patients. But with the advent of stem cells, now the capacity to regenerate, for the bone to regenerate by itself has been proven, and this is another advance which has been used in avascular necrosis. The other thing is diabetic ulcers and diabetic wounds. A lot of people with diabetes develop wounds in their heel or big toe, which never heals, and it takes very long time to heal. And if the diabetes is not under control, sometimes they result in amputation or removal of a part of the foot because the wounds don't heal. But with the advent of stem cells, now these cells which have been injected into the wounds have caused accelerated healing, reduced infection rates, and also improved healing of the diabetic wounds. So this is another advances which has been used in plastic surgery, dermatology, and orthopedic medicine. So this is what stem cell is all about. It is a very new field, and it has got a lot of future and a lot of potential, and a lot of research has been going on with this treatment, and this is very promising in the future, and it is an upcoming medicine which you need to know in the treatment of osteoarthritis, tendonitis, and also diabetic wounds. Thank you.